You are a pediatric resident working in the pediatric ICU. A 7-month-old infant is admitted after suffering from a traumatic brain injury due to a fall. The child is currently intubated and sedated. The team is now considering the best method to provide nutritional support. The infant is hemodynamically stable, but due to the critical nature of their condition, early nutritional intervention is crucial. Patient history. Age, 7 years. Weight, 22 kg. History of present illness, traumatic brain injury. Following a fall from 6 feet. The patient has been intubated and is sedated on a ventilator. Current condition, hemodynamically stable. The patient cannot tolerate oral or gastric feeding due to gastroparesis. Past medical history, born full term. No significant past medical issues. The attending physician asks for your recommendations on how to proceed with nutritional support.
Question 1. What is the preferred method of nutritional support in critically ill children? A. Total parenteral nutrition. B. Enteral nutrition. C. Oral feeding. D. IV fluid supplementation.
Enteral nutrition.
Enteral nutrition is preferred over parenteral nutrition in critically ill children, whenever possible, as it helps maintain gut integrity and reduces the risk of complications. Parenteral nutrition is used when enteral feeding is not feasible or contraindicated.
Why might enteral feeding via a nasogastric tube be poorly tolerated in this patient? A. The patient has a traumatic brain injury. B. The patient is on mechanical ventilation. C. The patient is experiencing gastroparesis. D. The patient is sedated.
C. The patient is experiencing gastroparesis.
Gastroparesis is a common issue in critically ill children, especially those with neurological injuries or trauma. It can lead to poor tolerance of nasogastric feeding due to delayed gastric emptying, increasing the risk of aspiration.
What is an appropriate alternative to nasogastric feeding in this patient who cannot tolerate gastric feeds? A. Transpyloric feeding. B. Oral feeding. C. IV fluids only. D. Continuing nasogastric feeding, despite gastroparesis.
A. Transpyloric feeding.
Transpyloric feeding, where the feeding tube is placed into the duodenum or jejunum, 111 is a suitable alternative when gastric feeds are not tolerated. It bypasses the stomach and may decrease the risk of aspiration while providing early nutrition.
Which method is most commonly used to confirm the placement of a transpyloric tube? A. pH monitoring. B. Abdominal X-ray. D. Endoscopic evaluation.
B. Abdominal X-ray.
The placement of a transpyloric tube is typically confirmed by an anterior-posterior abdominal X-ray. The tube should be seen crossing the midline and positioned in the duodenum or jejunum.
What is a potential complication of transpyloric tube placement in this infant? A. Gastric ulcers. B. Perforation of the gastrointestinal tract. C. Pneumonia. D. Esophageal stricture.
One of the serious complications of transpyloric tube placement is perforation of the gastrointestinal tract, especially in infants. Misplacement of the tube or use of a guide wire increases the risk.
What bedside techniques can assist in the placement of a transpyloric tube? A. Right lateral decubitus positioning. B. Use of prokinetic agents like metoclopramide. C. Gastric air insufflation. D. All of the above.
D. All of the above.
A magnet-guided system is a newer alternative method that uses a magnet to guide transpyloric tube placement.